New Frontiers in Surgery and Medicine. Today we are meeting with cardiologist Dr. Renzo Cataldo from Flagstaff, Arizona, who specializes in cardiovascular disease and clinical cardiac electrophysiology with Northern Arizona Healthcare. He was voted by his peers as the top doc in Phoenix Magazine in a specialty, has more than 20 years of experience, and is one of the first electrophysiologists to utilize techniques to significantly reduce X-ray exposure to patients and staff. He has lectured regarding these techniques extensively around the country and internationally. He is part of a team of committed healthcare professionals who have gone to great lengths to provide quality care to his patients of Northern Arizona and the Navajo and Hopi Native American tribes living there.
My name is Renzo Cataldo. I'm a physician here at Flagstaff Medical Center in Flagstaff, Arizona, and I'm a cardiac electrophysiologist. Northern Arizona Healthcare is a system of two hospitals, one in Flagstaff, which is Flagstaff Medical Center. The other one is Verde Valley Medical Center in Cottonwood. I am the only electrophysiologist north of Prescott, Arizona. So there's a very large area of Northern Arizona that I felt was underserved from my specialty's point of view. This is a hospital that actually has over half of the patient population is Native American. So there was a very large need for somebody with my specialty, which is cardiac electrophysiology. There's the largest Native American reservation that's nearby here. It's the Navajo Nation, and the Hopi reservation is sort of contained within there. Very large numbers of patients that are Navajo and Hopi come to see us. There is nobody on those reservations that are treated specifically for heart rhythm disturbances in a specific way because of lack of personnel and equipment. An arrhythmia is a disturbance in cardiac rhythm. Sometimes they can be inherited, congenital. Sometimes they can be associated with stress or stressors in the system, such as too much caffeine or drugs that people take, medications that people can take. Other times can be due to significant heart disease. They're quite common. There's one particular common heart rhythm disturbance called atrial fibrillation, and depending on the age group that one considers, atrial fibrillation can be as common as up to 10% of the population in an older population. There are some people who have certain heart rhythm disturbances and they don't feel them at all and they can run marathons. Other times there are people who wind up with cardiac arrest. Other times there are people who have lots of other kinds of symptoms, such as fatigue, lightheadedness. They can develop a stroke and they just come in with a stroke, and it winds up that it can be due to heart rhythm disturbances. Large advances have been made in the past 20 years. The largest advances that have been made in the past 20 years are in the field of ablation therapy, in terms of carefully pinpointing where arrhythmias arise from and where abnormal heartbeats travel throughout the heart. There are many advances that have been made in the technology for the catheters that we use, but there are other advances that have been made in device therapy, say for example in pacemakers and defibrillators. There are new advances that we are looking forward to using at Northern Arizona Healthcare. Since we've implemented electrophysiology services from my predecessor and myself, our team basically allows for a very specific, high-tech, state-of-the-art treatment for populations that sometimes have been referred to as far away as Tucson. Tucson, from certain areas of the reservation, is about an 8-hour drive, if not more. And patients now are quite happy that we are following them in our office, in the hospital, and also remotely. And the devices that we implant, such as pacemakers, defibrillators, or even temporary devices that we install in patients, can be monitored remotely. So the treatment initially was with medications. Didn't work. We had to make sure that in the preliminary testing of her that she was otherwise reasonably healthy, at which she is. And we performed this procedure with no x-ray at all, which is something that the mapping system that we use is particularly geared for.
I had not been feeling well for quite some time. I went to the emergency clinic with a breathing problem. Learned quickly that I had a heart problem, AFib they call it. Ended up doing surgery. Now I feel like a recycled teenager. This particular doctor, he made me feel comfortable. All of his folks around me made me feel comfortable.
So this is something, being a nurse, something that is very nerve-wracking when it comes to your heart. And for me, I felt incredibly nervous about this. As soon as I came into the hospital, Dr. Cataldo was at the bedside in my pre-op. He was talking to my family. He was making me feel very, very comfortable, reassuring me, and just he's got a way about making this just not a very big deal. But he fixed me up, and I automatically, honestly, felt better. It's been life-changing for me.
I think the future of arrhythmia care is just going to get better here in northern Arizona. I've been fortunate enough to build a great team around me in the office as well as here in the hospital. I have a great base of physicians and other healthcare providers in the area that are continuing to learn more about what we do, and the patients just kind of come on their own. There's a lot of word of mouth. Hopefully they'll be happy with me.